Hi, folks. Bryan Lewis from KidneyCAN back again for another joint edition of the National Kidney Foundation's Facebook Live series. For today's discussion, we'll take a look at the issue of mental health and how to maintain good mental health as you go through your kidney cancer journey. So today we're lucky to be joined by Cristiane Bergerot, coming to us all the way from her practice in Brazil. Dr. Bergerot is a world-renowned clinician with an expertise in mental health, specifically for patients with kidney cancer. Chris, thank you for joining us today.
Thank you so much for this special invitation. Thank you all.
Hey, I'm also thrilled to have with us Dr. Adam Stern. By trade, Adam is a practicing psychiatrist from Harvard Medical School, but today he joins us as a kidney cancer patient who can share the experience in dealing with kidney cancer. Great to have you, Adam.
Pleasure to be here, Bryan.
Great. Let me see if I can set the stage a little bit and give a few facts and figures. So there's 431,000 cases worldwide diagnosed kidney cancer every year. There's about 74,000 cases in the United States. About 15,000 people die every year in the United States from this disease. It all too often takes people by complete surprise with what's called an incidental, or some of us think of an accidental finding, where it's picked up from another test for some other problem you might be having. Those words, I have cancer or you have cancer, or hit people. They can get overwhelmed, they can get depressed, they can feel lonely and isolated. And in a global patient survey run by the International Kidney Cancer in 2018, almost 50% of the respondents said they had not talked to their friends or family or their healthcare team about this issue. This is horrifying. So let's jump right in with some questions here. Chris, what does psychosocial, what does mental health mean in the kidney cancer space?
Yeah, so it is a subspecialty of oncology concerned with the emotional response of patients at all stages, all type of cancer, and also include families and caregivers.
So I'm also curious, Adam, can you share a little bit about your personal story and the impact that it had on you and what you went through psychologically when you were first told about this?
Absolutely. This is, I think, something that you hit the nail on the head when you alluded to the sudden shock of it, because for many patients, they're living a relatively normal life, as I was right before the diagnosis, and it came on like an asteroid out of space. You think that you're on one track with your life, and suddenly you're told things are quite different, in fact. And so it's not surprising at all that patients, their families, their loved ones, all go through a very complex set of emotions. Oftentimes, things like depression, adjustment difficulties in adjusting to their new reality, anxiety, worry, rumination, all of these things can really take hold. I know for me, it is a work in progress. I've been living with this disease for more than 3 years now, and it's never, I never quite get to a point where I say, oh, I'm feeling at ease with this. It's always a work in progress, but I can say that I've come a long way since the initial diagnosis.
Great. And let's right off the bat talk about this. We're talking to the patients here, but so much is impacting the caregiver as well. Chris, can you tell us, when you're treating patients, do you usually have family and friends there? Do you talk to the caregivers as well?
Yes, definitely. First, because caregivers and family members quickly become experts on the cancer suffered by one of them, and their daily observation usually provides important information for us in the healthcare team about how their family member are doing with the cancer or even with the treatment. So they're really important resource. However, they must be aware of physical and emotional symptoms that they can experience through this journey. I would say that including sleeping, like trouble sleeping or muscle aches, or when they feel more irritable than it was before, or impatient, or if they are experiencing some nausea or trouble on focusing, headaches, irritability, and different and many other emotional symptoms that I can report to you right now. But I would keep in mind what I was before my family member was received this diagnosis, and how I am doing right now. And because taking care of your emotional and physical health will make you more helpful and supportive person for your family member. So please take care of yourselves and to take care of your loved one.
Great advice. Adam, I know in the kidney cancer community, there is an online forum called Smart Patients. Do you have any thoughts or any input on those or other resources or any other items you might want to share with some of the folks listening today?
Sure. I think that Smart Patients is wonderful, and I certainly participate there. But I think I want to take a more broad response to your question, which is to say that there is an entire range of resources available to patients and family members, caregivers after diagnosis. It goes all the way from the super professional one-on-one therapist or psychiatrist that you might meet with, all the way to an unmoderated open forum on Facebook, something like that. And so what I want to say is that the people at home listening to this should be mindful of what it is that they're signing up for. One of the reasons I like Smart Patients myself is that it's a moderated forum, generally moderated by people that have been through a lot and know a lot. And that was comforting to me as a patient. I could learn and know that the information I was learning was legitimate. The same goes for when you meet with a professional. You have a certain sense of their credentials and that you can trust that what they tell you is real and true. So other areas, you just want to proceed with caution. Certainly certain online forums can be filled with misinformation and potentially do more harm than good.
Got it. So can you just talk a little bit, Chris, about you identified sleep and nausea and headaches and other physical symptoms. Are there any other specific mental health issues or symptoms that people need to be keeping an eye out, either as the caregiver towards the patient or the patient towards the caregiver even?
Yeah, sure. So I would say that when they start having trouble to sleep, or when they get more impatient when they are taking care of their loved ones, or even when they're discussing with their family members or other caregivers, you should be more like aware of how you are experiencing all this kind of situation. So exactly what is most impactful for you, and what is really like making you suffer a little bit more than you usually suffer when you are dealing with like challenging situations. So if you start notice that you're experiencing this kind of difference, I would say be honest. Ask the patient how you can best support him, or share with the patient how you're feeling, or how you would like to support him, or how you were understanding all the situations. And even try to meet with a professional such as a psychologist or a social worker. They will probably listen to your concerns and help you to create like a plan on how to deal with this situation.
Adam, thank you, Chris. Adam, let me ask you this. So this is a boomer comment probably. Back when I was a kid and young teen, you didn't talk about mental health. It was taboo, just like cancer was. Now the landscape has shifted dramatically. What do you tell folks that are new to this world of what they've been diagnosed with?
Yeah, I think that that's actually one thing that is true for both cancer and mental health, just like you said, Bryan. And the thing that those share, they're both stigmatized areas of diagnosis, areas of concern. And there's something that you can be suffering with and other people can't see it. They're invisible disorders or invisible illnesses. And that can be challenging because when other people can't see the illness that you're dealing with, they have even less of a sense of what you might be going through. So I do agree that times have changed. People are talking about mental health now in a way that never really happened before. And the go-to example in recent months that I say is, Meghan Markle told Oprah that she was experiencing suicidal thoughts, and she was lauded for this. This was a really wonderful moment where she was very open about something that was very personal and something that many tens of thousands, maybe even hundreds of thousands of people out in the world are experiencing. And so I think that we're definitely entering a phase where mental health is having its moment, rightfully so, and I hope it'll continue for a long time and even lead to greater openness.
Yeah, you touched on something there, which is the invisibleness of this and keeping an eye out for symptoms. And are there any other resources or apps? Do you have any any thoughts about online, apps or any sources other than ones we'll show some at the end of today's show, but anything you could recommend or stay away from?
That's a great question, Bryan. So, it's the year 2021 and everything has an app, and mental health is no exception. There are tons of apps available right now. The challenge, like I was talking about earlier, is weeding through what's real and legitimate and what's not. So at the end of this presentation of Facebook Live, we're going to be putting up some information, some resources about how patients can figure out what apps might be helpful for them. Right now, I'll just comment that right now the app space in mental health is a little bit like the wild, wild west. It's not regulated, and it's very confusing for a lot of people because there's just an abundance of options, and you don't necessarily know what's the best option for you.
Got it. Chris, let me ask you this. So, this is going to be a little bit gender biased towards males, but so many men that are diagnosed with kidney cancer take the stoic approach a lot of times. They don't want to talk about it. They want to put it behind them. They want to, not open up about their emotions. What do you tell a family or a patient out there like this?
So yeah, definitely. We have a lot of difference between gender. Women patients tend to request support as early as possible, and for male patients, sometimes we just identify some symptoms when they're experiencing some moderate to severe symptoms. So I would say first, if the family member or the caregiver knows that there is some difference because they know much better about this patient than we as a healthcare team, I would suggest the same. So please contact the healthcare team, contact the oncologist provider, or even try to discuss this case with the social worker or with the psychotherapy from your cancer center. If the patient is starting to know that they are experiencing some issues, that they are feeling more isolated or alone, or experiencing different symptoms such as loneliness or even sadness, or being more irritable or trying to avoid a social relationship, something that is different from the behavior that they had before the diagnosis, I would say the same. Please talk with your oncology provider. He'll definitely have a lot of options to give it to you. It's normal to feel sad. It's normal to feel anger. It's normal to feel anxious, or even to experience some fears about cancer. But for sure, when you start sharing what your experience or even what you're feeling, it seems that all this type of problems you can see it more clearly, and you start to identify more resources in your daily life to cope with this cancer trajectory. So yeah, I think talk and share your feeling and experience. It is one of the best options to cope with it.
Great. And I think in addition to talking, it sounds like, I don't know, Adam, are there, exercise, nutrition also probably are beneficial. Are there any mental health issues that are specific to kidney cancers compared to other types of cancer?
It's an interesting question. I'm not sure that it separates in that way. Certainly comes with its own challenges. Certainly kidney cancer patients have a different, somewhat, I would say, unique path from certain other cancers, because the treatments that kidney cancer patients get may lead to different side effects, may lead to different kinds of outward appearances than someone getting chemotherapy, traditional chemotherapy, that kind of thing. And so it is, what I would like to do is actually reflect back on what Dr. Bergerot said, which is that, you really want to not hold back from your oncology team. That's the bottom line. The most important thing is that you're open with your team, because they won't know if there's a problem unless you let them in on that. And a good oncologist will be able to guide you toward the appropriate resources, toward a psychotherapist or a psychiatrist, social worker, anyone that might be able to help, address the mental health concerns that you're having.
Got it. All right. Well, so what I'd like to do now is we take a look at some of the questions that may be coming in through Facebook. I'll remind you folks on today's session that if there are any questions on this subject, please post them. We'll do our best to answer as many as we can. If we run out of time, please know that all of your questions will be addressed on the National Kidney Foundation's Facebook pages as well as KidneyCAN's after the program. It looks like we've got one here. This one's a little specific. Have you lost a friend since diagnosis? Have folks you thought were true friends disappeared? How do you work through this? Adam, you want to try that one?
Yeah, sure. I think that, earlier I referenced the diagnosis itself as feeling like an asteroid, coming down from space and hitting the Earth. That's how it feels at the individual level. But then you sort of become adjusted to it and you continue with your life. And what I have to appreciate and try to appreciate is that for the other people in my life, it's kind of like if I say, hey, maybe we can get coffee and chat, they're sort of like, but the asteroid just hit. And for me, it's like, well, the asteroid hit 3 years ago, so I'm sort of used to it, So I have lost some friends, some people that I thought might be, sort of more concerned or more in it with me, haven't been. And then the opposites happened as well, which I have to, call out as well, where some people that I never would have guessed would really truly be there for me have stood up and come to my aid and supported me. And I think everybody reacts to this kind of physical and emotional trauma in a different way, and it is something that's hard to predict.
Got it. Well, thank you for sharing that. Here comes another question. Laura would like to know about how to find a good mental health professional for oncology patients. Any thoughts on that, Chris or Adam?
Yeah, sure. I think you should first try to talk with someone, with some specialists. For sure, you're going to identify anyone that will fit with the way you think that you will be comfortable to share your feelings and experience. And keep in mind that there are thousands of options of support therapy for you. So sometimes you are not able to, but you're not going to identify with the first option, like the in-person psychotherapy, the traditional one. But sometimes you're going to be more friendly with other types of interventions, such as integrative medicine, or even the online self-management interventions. We have a lot of different types of online intervention right now, as Adam has mentioned before. And for sure, the psychosocial team from your cancer center will know how to put in touch with this guy with the intervention that it is trustful, and that you can have more benefit with this, and that also fit with the disease you have, and also with the emotional symptoms or physical symptoms that you're experiencing right now. So I would say, please try one time and try a second one and try different types. So someone will be will find an identification with the cognitive behavior therapy, and the other ones with the the training and attention. So we have really multiple options to help you to better deal with your emotional burden right now.
Great, thank you for that, Chris. So what I think also, I'm hearing is, expressing yourself, talking about these issues with someone that's a trusted advisor or friend or part of your care team. What I'm curious about, Adam, what do you do with your family members? What do you do differently with your family members, your children? Any insights there?
Yeah, so I'm lucky, I'm fortunate because I have a very loving, caring, supportive family. So I can go to my family with anything. But I also identified pretty early on in my journey here that I needed a place where I could talk to someone who was not a family member, a professional that was completely out of my social circle. I needed a place where I could be totally raw and vulnerable in a way that I wouldn't want to burden the people in my life, especially my wife and children, for example. Communicating with kids is a very challenging topic. We're still trying to figure out that path as we go. Our kids are very little. And some of the principles that I know are important are meeting the child where they are, not forcing an adult's version of what's going on onto a child, but also not sugarcoating things or being dishonest toward a child. So those are principles that I hope will carry me forward in the years ahead. But it's a challenging topic for sure.
Great. Thank you, Adam. So you're touching on something here. We talked about being overwhelmed, possibly lonely, isolated, and possibly leading to depression, which is a condition that we need to address. So can you talk a little bit about depression, medication, being treated for that? There's still stigma around depression here. I don't know, Chris, you want to give a try, and then maybe Adam, you can give your psychiatric perspective.
Yeah, so I'm going to give the psychological perspective. So we have a lot of options of psychiatric medications, and I would say that usually I say to my patients that it's something you can compare like this kind of medications when you have like some injury and you need like some support to relearn to walk or relearn to have your own ability back. So it is something that it will be like just there to help you to minimize all this suffering in a very smoothly way. And sometimes give you even more like capacity to share your feelings and your emotional symptoms and also physical symptoms. I think Adam and I are always like saying that you have to share, because when we review the literature, we saw that just like 5% of patients request some support from the healthcare team. So I think that because of that, we are like trying to at least to make sure that this message will be covered. And trying to, for sure that Adam will have like more information regarding how you can think about like psychiatric medication. Yeah, please, Adam, go.
Sure. So, I think that one of the biggest concerns that people have is that a medication that's aimed at something like depression or anxiety will somehow change their personality or change who they are. And, frankly, that's really just not how these things work. The way that I like to think about psychiatric medications is that with your sort of with the patient's goals and the person prescribing's goals aligned, you can actually help a patient become the version of themselves that they want to be, the best version to handle these new stressors in their life. And so if you imagine that walking through the world with the weight of a cancer diagnosis is kind of like wearing glasses that have a lens, it's a filter through which you're seeing the whole world, the medications might be able to help lift that lens, lift that filter, and let you see the world as it is. They're not going to take away the problems, but they might help you adjust to those problems in a way that's healthy and in keeping with your values. And then one final point is that it's not a one-size-fits-all approach. So certainly for some people, a certain class of medication might be helpful. For others with other symptoms, a different class of medications might be helpful. And for some people, medications aren't the answer, and it'll be something entirely different, like psychotherapy, or even something entirely out of the scope of our field. Some people find that pursuing hobbies with a new passion, that changing their lifestyle in some way has a major impact. And so certainly all of those are options available to us when we're dealing with these kinds of things.
Great. So Chris, I want to ask you, so there's been a lot of talk about patient empowerment and patient engagement in their disease and what they can do about it. Can you comment on patient engagement and empowerment and patient quality of life and how it plays into mental health?
Yeah, we have seen that when we make patients part of the treatment decisions, all their emotional symptoms get improved, and even their quality of life. So it's really interesting when they know more about their prognosis or even the treatment that they have to choose from. It seems they are the right person to see what will match with their own perspective or even with their own goals of life. So it is really important to make patients part of all these decisions, and also to try to translate all the scientific evidence in a way that they can really understand and really can decide what type of treatment they should get. So for sure, they're an important piece of everything. So they are really the person who can manage it, who will suffer from the side effects, and who will also feel more comfortable doing what they really believe.
So Adam, I've got to hear your perspective on that as well. You wrote an article a couple of years ago about doing something. How does that play into your quality of life, your mental health going through this battle?
Absolutely. I think that agency is something that we lose when we are diagnosed with cancer. We didn't have a choice in that. And so what I found is that the more active I am, even in doing things like this, the more active within the community, the more that I feel like is good, that I'm contributing in some way to the world, the better I feel about everything, about myself, about the diagnosis, about having some sort of agency within this new normal. And so I do think patient empowerment and engagement is a good thing.
So it looks like we have one quick question here from Lisa. If you have a spouse, how do the two of you deal with it together? Chris, you want to try that one?
Sure. Yeah, I would say that be honest with your spouse and trying to really say how, so if you're the patient, try to really explain how you would like to be supported. Because it, despite the fact it's something that it's obvious for you, it is not for your husband or for your wife. So I think we should try to establish like a clear conversation and try to make sure that the other one gets exactly what we would like to be supported. For example, oh, please, could you do the laundry for me? Or please, could you take care of our house during this day? Because sometimes for the other one, it seems that this kind of activities is helpful for you to find a balance between your emotional symptoms. So I think when you try to establish like a clear conversation and you start to be honest, it's easier for both parts. And if you're the spouse, I would say, yeah, please be honest too. Try to ask simple questions like, please, during your treatment, what do you want from me? What exactly? How can I help you to manage all these situations? And how can I help you to make it easier for you? For sure, you will find like a balance between you both, and for both will be really helpful and less stressful to cope with all this trajectory with this journey.
Great. Well, thank you, Chris, and thank you, Adam. I do want to ask, with all the open dialogue these days about concerns and fears and its impact on daily living, if you have to give the audience one or two takeaway nuggets, Adam, what do you have for us?
Yeah, the takeaways here are to be open, to be honest, to engage with both your team, so whoever makes up your oncology team, as well as the people in your life. Meet people where they are is the other takeaway. That's both for patients and caregivers.
Great advice. Thank you. Chris, do you want to give us a nugget or two?
Yeah, I would say something very similar. So be honest, be clear, and try to not like make anything like, not suppose that someone will like know exactly what you're feeling or suffering. Please tell. I think we have the word, and word is a powerful way for us to get the best support and the best help during this journey. Thank you.
Great. And I just want to echo that as well. One of the things I want to tell people who are listening out there, never think that you're a burden. Your family and your friends and those who love you want to help you. Imagine if how you'd feel if you were shutting them out. So let's lean on our families when you can and your loved ones. So I wish we could keep talking about this, but unfortunately we've run out of time. In case we didn't get around to answering your questions, you can find these questions and answers on the National Kidney Foundation's Facebook page, as well as on KidneyCAN's. I'd like to thank our sponsors for making this possible, for their generous support. And I especially like to thank Chris. Thank you.
Thank you so much for inviting me. It was really amazing.
Great. And Adam, really thank you for joining us and sharing your personal story today.
Thank you. It's a pleasure to be here.
Great. So on behalf of the National Kidney Foundation and KidneyCAN, thank you for joining us today. We wish you all good health.